maybe wrong interpretations. They got some of the stuff wrong 2,000 years ago, but don't fault them. All right, so here we go. So here's the issue. Western medicine wants the double-blinded, placebo-controlled, randomized clinical trial. It's the gold standard for evidence-based medicine. But trying to do that with acupuncture is fraught with problems. There are so many different schools of acupuncture, styles of acupuncture, ways to study it. There are even different ways of finding a point or treating a point, whether you use electricity or heat or manual manipulation. And then the big issue is there's not been a good option for a placebo control for acupuncture. They've done acupressure, that still has an effect. They've done poking and taking the needle out, that still has an effect. They've done putting a needle that's slightly separate from where it goes, it's still in the dermatome, so it still has an effect. So that's part of the problem why you can't show that it's better than a fake treatment of acupuncture, because even their fake treatments have some effect. And then the other thing is you can't blind the practitioner. So if a practitioner is putting needles in someone, they kind of know they are. So then you have all these different kinds of studies, studying different outcomes, interpreting and extrapolating, because you can't really find out what's going on in the body without taking off the head, looking inside. So you're kind of interpreting, and then when you try to take all these data and put it in a meta-analysis, it's very soft and ambiguous. So we are left with either each study gives us one little piece of the puzzle, or we try to squish them all together and then you don't really get anything strong. So this gives the naysayers a lot of good ammunition, well, it's not proven. But I say that you really can't prove it doing it that way. And then, even for the people who are using acupuncture, who are researching it and finding out a lot of the mechanisms and some of the information and little pieces of the puzzle, when you get some good information, it's underused in clinical policy or clinical guidelines. So there was one meta-analysis, this is one example of after a stroke, people who can't speak. There are many studies that show scalp acupuncture will help those people, but because the data is not disseminated, it's not looked at seriously, they're not really using these techniques that are actually pretty proven. So, and there are lots of those examples, so you get some data and people are hesitant to really jump on it. So, a real experience of acupuncture. It's a subtle thing, it's a complex thing, lots of moving pieces, and it affects the mind and the body. And the human body is not something that you can describe in a conventional model. Physics of complex systems, don't let me get into that, because I don't really know what all that is, but there is definitely a reliance on acupuncture, the body healing itself, which is not something we normally think about in Western medicine. And then the treatment has to change over time based on how the person is doing. And then there is that practitioner-patient interaction, and there is an intention when you put a needle in. And I kind of liken this, again, this picture is like a robot and a human hand. That's the difference. So when you put a needle in, you have an intention. And we've all learned acupuncture from our mentors. It's like an ancient art that's handed down, and there's like a resonance with that. So not to get too woo-woo, but there is something to that. Okay, so now that we've looked at just some of the pitfalls and why you cannot prove acupuncture using those kinds of studies that we use for pharmaceutical interventions, I do want to share a review article. It was done last year, and it looked at autonomic nervous system dysfunction and acupuncture. In general, a review article is just looking back. This is looking back over 20 years of PubMed articles And it really just generates questions. It doesn't really give you answers. It just says, these are good questions. But it suggests that the neuromodulation, so the points affect the nervous system. And this is one mechanism of the whole complex system. But this is what I've been saying all along. I've been telling people about this all along. So the autonomic nervous system, are you guys familiar with the sympathetic and the parasympathetic? So sympathetic's fight or flight. And then the parasympathetic is rest, digest, heal. So when you put the points in, all these studies that they looked at kind of show, they point in the direction that that's one of the ways that acupuncture helps. It calms the body down, gets it into a healing state. And then it affects things like headaches, depression, sleep, functional gut issues. One thing about this is pain affect. So not only does it help with visceral function, brings pain levels down, but it helps the way people feel about their pain. And that's like the mind part of the mind and body. And so if you've heard the word catastrophizing, it's if somebody's going into a surgery and they're already thinking things are going to be scary or terrible, then they're going to have poorer surgical outcomes and more higher pain scores. So pain affect is not only the type of pain you're having, how long you've had the pain, but it's also all the prior experiences you've had with pain and all the other things going on in your own environment. So the autonomic nervous system is part of that, and acupuncture can help with that. The brain and the spinal cord are not living in isolation. Each neuron is affected by the chemical soup that it's in and all of the things going on in your limbic system, your fear centers, your environment. And then, so the autonomic nervous system's one, and then at the bottom, it's some of the other mechanisms that have been studied, and we're pointing in the direction of these are things that acupuncture works on. So central pain processing, endorphins, that's kind of a common one everybody's heard. Oh, the needles raise your endorphin levels. There's increased perfusion when you put a needle in, and increased serotonin in your spinal cord and cortisol in your spine. So again, studies aren't the end all, they're not going to prove it, but there's so much information in the literature about this. Okay. So you're not going to get definitive proof, but I will give you the benefit of my clinical experience. You're not going to get this stuff from a medical journal, but I will share some of what I know. People simultaneously, again, new patients to acupuncture, they simultaneously think it's magic and they have to believe in it for it to work, but they also think it's magic and it's going to work right away, or they're going to get one needle and it's going to magically make things better. It's not magic, and it's your body healing. So I'll give you some examples of what I tell my patients, and then some examples of what I've seen and what you can expect. So acupuncture has a cumulative effect on the body. So you get one treatment, you might get into the healing state, you might get a little bit of a benefit, and then it'll last a certain amount of time. Then as the symptoms resolve, as the body heals, you can come in less often, and the treatment effect should last longer and longer after each visit. But then you want to do maintenance. So here is, the headache patient is a great one. This was a patient who came in one time for headaches that were so bad she was missing work a lot. So she actually had a good result from the first treatment, and she had no headaches for about 3 or 4 weeks. And then she started missing work again. So the person who referred her said, "How are you doing? Are you getting headaches again?" And she's like, yeah, I had that acupuncture, but it didn't work. The headaches came back. So that's just kind of, this happens all the time. People will give up. They will assume that when the symptoms return, that's a failure of treatment. But the fact that the symptoms went away was great proof that the body was responding. So here, the other two examples, one is acute pain, and one is chronic problems. So I had a patient who was coming in. She came in 3 or 4 times over the span of a couple months, and she had some chronic joint pain and tendonitis, and they were not really changing. She would have transient benefit, but she was getting discouraged. So then I was treating her, and as an afterthought, she's like, oh, and by the way, I twisted my knee really bad yesterday, and it really hurts, so just letting you know. And so when I treated her, the knee pain got better, right? She was almost surprised. She called, she's like, my knee's better. Like all this other stuff's not getting better, but my knee got better. So the body can heal a superficial or an acute injury much quicker than something that's chronic or deep, affecting a bone or a nerve. And then finally, this was actually an exciting one. This was somebody I followed for years. He initially came in for neck pain or back pain. So we were treating that, and it took him about 8 to 10 treatments for that to start feeling better. And that's about average for something that's been there 15 to 20 years. He also had peripheral neuropathy, and he had a chronic pelvic pain, so it was a lot of visceral bladder symptoms and really uncomfortable pressure and radiating pain. And that didn't budge. Like, we treated him for 6 months. His neuropathy started getting better, but he kind of was like, well, maybe this isn't going away. He was happy about his neck pain being better, so he did keep coming for that. And then about a year, actually a little bit more than a year, he was ecstatic because his pelvic pain had finally decreased and resolved. So it's just one of the reasons why you gotta keep coming. But if he was excited, I was excited too. Okay, and then this is just a slide to talk about, again, there may not be adequate proof for some of the evidence-based scientists out there, but everyone is doing it. So acupuncture is not going away. It's almost like, I don't know if anybody remembers in the 1880s, there was something called orifice surgery. It was this fad, and people were like dilating rectums and stuff. That disappeared pretty quick because it wasn't working. And I don't know if anybody remembers the cocaine toothache drops that they used to sell and the tonics. Anyway, those disappeared because those were really bad for you. But unlike that, acupuncture is here to stay. It's like 2,000 years and counting. And at this point, there are major hospitals who now have staff acupuncturists like Mayo Clinic and Mass General. The Department of Defense has funded training for their military physicians since like 2008. Now the ACUS Foundation is doing the training, and they actually get charitable donations to fund that. Health insurance is starting to cover acupuncture. And then in the US, about 10 million visits per year to an acupuncturist. They did a survey of practitioners, just for your information, in 2018, and people are most often coming for pain and mental health management. The other top categories were immune system dysfunction, gastrointestinal, GYN, and neurological conditions. And remember, it's not just about the pain people have or their symptoms, it's about how it makes them feel, the pain affect or the symptom affect. And I think that's where acupuncture really shines. It helps people feel better about how they're starting to feel better. Okay, and now, because you were so good and you listened the whole time, I'm going to give you some of my super cool points. These are the ones that make acupuncturists look like rock stars. They are fabulous and exciting, and if you hear one of these that you think will help you, you can ask for it by name, but I will warn you, some of them are not for the faint of heart. Okay, the first one is just known by KB 1 or 2, and it's a deep point, and it goes either in the arm or the leg, and you slide it all the way deep between the two bones. There's a little, right? People are getting excited, I can tell. So what you do is you want to get through that little tough tissue that's between the bones, and then you twang the needle. That's a medical term. You twang the needle. And And what that does is it helps the autonomic nerve fibers, the efferent nerve fibers in the syndesmosis. It's a fascia between the two bones. And it resets the autonomic nerve fibers because some pain is conducted by those fibers. So I had a patient who had a really bad injury to his ankle and he had chronic pain in it. So when I did this and I twanged it and reset it, he actually got off the table and he was like walking funny. And I'm like, what happened? He's like, it's not hurting. It's not hurting. So it was fun. The next one is called wood anger. It's 2 little tiny needles in your index finger. And this is for if you have anger in your bladder, which is a thing, or if you have anger stuck anywhere where it's creating irritability or headaches or depression. So anytime you use these points, you will be happier and more relaxed afterwards. It's lovely. The ting points, I always call them ting points because that's the sound I make when I stick them in. They're right at the base of your fingernails and toenails. So you put them in, you're like, ting. So I will tell you, one of the patients I put them in actually got euphoric after I put them in. She's like, wow, that's like a beautiful, good feeling. So, I mean, I don't usually get that response, I'll warn you, but that could happen. These are for acute injury. So a bruise, a burn, a sprain, a strain. If you do it within the first 24, 48 hours, you will have like just like the acute knee sprain, it'll just get better quick. Yeah, okay, and then the prefrontal points, these are also interesting insertion. You put them in on the forehead, but instead of just tapping them in, you slide them back. So they, I told you, not for the faint of heart. These actually don't feel bad going in, but they're good for foggy brain. They're good to help you think clearly. So in the extreme case, when you just had trauma, you're like anxious or dissociating, they're really good to bring you back. But for everyday stress or insomnia, and you can leave them in for a while if you're withdrawing from a medication or if you're going through some kind of detox, you can leave them in. Okay, I did flower bone 1 on someone today. It's 4 points on the bottom of your foot. And it's intense, but it's for vision problems. And people who get this and their vision improves, retina problems or anything to do with your eye, floaters, they will ask for it again. And I'm like, really? You want me to put them in the bottom of your foot again? They're like, yes, it helped. Okay, 4 horses. This is not a bad one, unless you ask my husband, because I put them in him all the time and he always yelps a little bit. But they're thigh points. They're actually 3 points. I don't know why they're called 4 horses. There are only 3 of them. But you put them in deep into the thigh muscle, and I keep seeing people flinch. When I say deep, you can feel it. You can feel it. But these help to get rid of a cold. It's like magical cold treatment. But they're also good for autoimmune problems, fibromyalgia, autoimmune. And again, they're really, really strong points, literally and figuratively. And then finally, this is just because you never know what you're going to find in your old acupuncture textbook. Bladder 15. It's located on the upper back near T5. And it's the shoe point of the heart, so it affects anything related to the heart, palpitations, heart pain, affecting your sleep. But in my book, it actually says that they're good for if you have dreaming of sexual intercourse with ghosts. I told you there was some superstition left over from those old days. So that is all I have for you. Thank you for enjoying that. I do have my references at the end. But basically, I just want to let you know I continue in this field because I'm curious. I keep wanting to learn more. I love sharing knowledge with my colleagues here, with my colleagues at my conferences, who continue to innovate and do the research. And because of all of the people I connect with, the benefits that I've experienced for myself and my family, and then all of you, my patients. So thank you so much.